So what I do is I try to get them excited about being our partners in this process. So what I always do if I see that people are reluctant or perhaps sort of dismissive is I want them to understand that what we, for example, at Dartmouth have the only Center for Shared Decision Making in the world, and so how amazing is it for them to have these services available to them, and that we're doing this to help them make good decisions and to support them, and we're offering it for free. And very few people in the world have that available to them. And then I'm going to go on to explain that even if you, for example, don't want to enroll in our study and answer our questions, you need to watch this video because your doctor is expecting that you'll know the information that's in it when you get to your appointment. So we need to kind of help you prepare and have thought about what you want so that when you get there, that the two of you can do the work that you need to do. Surgeons who do hip and knee replacements, and we had one who was a young guy who had just come on board and was a great champion, and then this was a friend. I think they trained together, and he came on a little bit later, but he was, you know, involved with the project and trying to be supportive, but I think really he was just going along because he thought he should. So one day he came and confronted me out in the hall in front of my office and said, "Kate, I sent you a patient the other day to borrow the video for knee osteoarthritis, and I already had him booked in the OR to have both of his knees replaced. I wanted to make sure he had this good information, so he came and got the video, and he and his wife took it home and watched it, and she called me the next day and said, 'We're canceling the surgeries.'" And so to me, this was a win for the patient and his wife, who, when they were informed in a fairly objective way about all their choices, decided not to go through with the surgery. And the surgeon said, "You know, if I'm losing business." And I said to him, "Now, come on. This is a guy with knees that hurt. He'll be back to you when he's ready. And that's when you want to operate on him, isn't it?" And he looked at me and he thought, "Oh yeah, you're right." So I think it was a win for both of them, and I have to say that after that conversation very early on, I've never heard another complaint from him, and I have a feeling he still has a 3-month wait list for people who want to have their knees replaced. So he's still pretty busy. The second story is one that is also a win for everybody, but it was a particularly poignant. This is a woman with breast cancer. And we have a system where every woman newly diagnosed with breast cancer is given the video before she talks to the surgeon about her treatment choices. And we also asked a lot of questions as part of a study, so we knew whether she understood the important knowledge questions about her choices, and we also knew what her values were. And that information was fed to the plastic surgeon with whom she had an appointment after she saw the general surgeon. So she and the general surgeon had decided about a mastectomy to remove the entire breast. And then she went to see the plastic surgeon about having breast reconstruction. And the plastic surgeon saw her, what she was leaning towards, and her knowledge answers and her values, and realized that what she was saying she wanted did not at all match with what she really cared about and valued. So rather than having a conversation about her choices for different kinds of breast reconstruction, she said, "Let's talk about why you're saying you want a mastectomy when you really, really want to keep your breast." And the end of this story was that this woman watched this video 3 times, had a number of conversations with me and others of my staff just to clarify different points that she was stuck on. And she ended up having breast-conserving surgery, a lumpectomy, no breast reconstruction. And our plastic surgeon was thrilled that she didn't do surgery on the wrong patient. I am hoping that the general surgeon was also thrilled that she ended up having the surgery that was right for her, and I know she was happy with what she got when she finally understood it. So that, to me, is, you know, that's why we're doing what we're doing. At the Center for Shared Decision Making, patients are referred to us to come and pick up a video about either a condition they have or a decision that they're making relevant to their health care. And sometimes when people come to me, it hasn't been explained to them the value or the purpose of this video, so they may either not really want to, you can tell they're reluctant, they don't really want to borrow it, you're pretty sure they may not even watch it, they probably won't fill out the questionnaire that helps us understand what they're learning from it. And so one of the things that we like to really emphasize with these people is that this is how we do things here at Dartmouth, so that for every person with your condition, it's really important for you and for us that you do watch the video and really have a good understanding of what your options and the risks and benefits of those options are, so that when you come back, your next conversation will be that much more valuable for you, and you and your doctor can really talk about not so much what the disease process is, because that's one of the things this video will cover, but really what do you care about, and what are the next steps you're considering, and how can you and your doctor or whoever your healthcare provider is together make a good decision that helps you to move forward based on what you want. So part of what this video will do is really help you to hear what other people have done, feel how that feels for you, whether that is something that matches with kind of the things you care about, and help you just to kind of explore maybe parts of a decision that you've never even thought of, partly because you may not be used to understanding that you are an incredibly important center of making this decision. And when you discover that you're the one who needs to do that, that can be a little bit scary. So this gives you lots of tools to support that. Breast cancer, every one of them was scheduled to come to our center, and so they watched the video there, and with often their partners or their spouses or their children, whoever was with them. And so they would walk out of the room after they'd watched the video, and mostly people take it home, so I don't get to get their immediate emotional reaction to it, but it was not unusual for women to be kind of tearful, because they were so thrilled to get this information, and it was really giving them exactly what they needed to think about a really scary, hard new diagnosis. But the thing that I liked almost better than that was the partner or the spouse would come out of the room and just shaking their head and saying, "That was so great, because now I know exactly what she knows, and so I can support her with this, knowing the same information. I understand what she's basing her decision on." So that's been wonderful to hear that over and over again. And a very sweet example, one day we had a couple call and say, could they come and watch that video in our conference room? Their daughter had already seen it, was having her surgery that day, and while she was having her surgery upstairs, they had flown in from out of town. They wanted to watch what she had watched so they could understand her decision-making process, even though she was already, putting that into place. So they watched it while they were waiting for her to be done her surgery. And I just thought that was such a lovely way to participate in what she was going through and be able to support her going forward, because they had come to take care of her as she recovered.